Hello, I am Nazzra Azera and my group member nornafieshya would like to elaborate more about ultrasound. Ultrasound is a type of sound wave with frequency higher than the upper limit of human hearing, which is above 20,000 Hz. It is commonly used in medical imaging to create pictures of the inside of the body, as well as in various industrial applications for testing and cleaning materials. In a simple term, ultrasound is a sound or other vibration having an ultrasonic frequency, particularly used in medical imaging. Basically, ultrasound employs sound waves that are above the audible range of human hearing, typically above 20 kHz. Also, is commonly used medical ultrasound frequency range from 2 MHz to 15 MHz. Higher frequency ultrasound waves have shorter wavelength which allow for better resolution in imaging. To add more, the propagation of ultrasound wave in a medium orbit. Ultrasound waves require a medium to propagate such as body tissue as they are mechanical waves. They cannot travel through a vacuum. It reflects back to the ultrasound device which then converts this echo into image or data. The mechanic of ultrasound involves the generation, propagation, and reception of sound wave within a medium. Ultrasound waves are generated using piezoelectric crystal within the ultrasound transducer. This device generates and receives sound wave. When an electrical current is applied to this crystal, they vibrate and emit sound wave at a specific frequency. This crystal converts electrical energy into mechanical energy and vice versa. The electrical signals are processed by the ultrasound machine to create real-time image. Advanced algorithms analyze the amplitude and time delay of the echoes to construct detailed image of tissues and organs.
And now we will move on to the advantages of ultrasound uses in medical diagnostic imaging. First, ultrasound is very non-invasive and safe. Ultrasound does not use ionizing radiation, making it safe for patients including pregnant women. Next, ultrasound use real-time imaging allows for live monitoring of moving structures such as the heart rate or fetal movement. The other advantages include it can be directed by beams, obeys the law of reflection and refraction, and it is also reflected off of small objects. Furthermore, we have the disadvantages or limitations uses of ultrasound in medical uses. First, ultrasounds have poor propagation through gas, as ultrasound waves do not travel well through air or gas, necessitating the use of a coupling gel to eliminate air between the transducer and the skin. Next, ultrasounds also have very poor image quality. Ultrasound images can be relatively noisy with poorer contrast compared to other imaging modalities like MRI or CT scans. This can affect the clarity of the images, especially in deeper tissues. Now, here's the biggest question. How does an ultrasound work? Before I tell you that, I want to share a little bit of history about ultrasound. In World War I, French scientists sent ultrasound beams into the ocean to detect nearby enemy submarines. This early form of sonar was a huge success, in large part because sound waves travel even faster through mediums with more tightly packed molecules like water. In the 1950s, medical professionals began to experiment with this technique as a non-invasive way to see inside a patient's body. Today, ultrasound imaging is used to evaluate organ damage, to measure tissue thickness, and detect gallbladder stones, tumors, and blood clots. But to explore how this tool works in practice, let's consider its most well-known use, which is the fetal ultrasounds. First, the skin is covered with conductive gel. Since the sound waves lose speed and clarity when traveling through air, this gooey substance ensures an airtight seal between the body and the one emitting ultrasound wave. Then, the machine operator begins sending ultrasound beams into the body. The waves pass through liquids like urine, blood, and amniotic fluid without creating any echoes. But when a wave encounters a solid structure, it bounces back. This echo is rendered as a dot on the imaging screen. Objects like bones reflect the most waves, appearing as tightly packed dots forming bright white shapes. Less dense objects appear in fainter shades of gray, slowly creating an image of the fetus' internal organs. To get a complete picture, waves need to reach different depths in patient's body, bypassing some tissues while echoing off others. Since longer low-frequency waves actually penetrate deeper than short high-frequency ones, multiple frequencies are often used together and composite into a lifelike image. The operator can then zoom in and focus on different areas. And since ultrasound machines send and receive cassettes of waves in real time, the machines can visualize movement. The wave used for medical ultrasound range from 2 million to 10 million Hz, over 100 times higher than human ears can hear. These incredibly high frequencies create detailed images that allow doctors to diagnose the smallest developmental deviations in the brain, heart, spine, and more. Even outside of prenatal care, medical ultrasound has huge advantages over similar technologies. Unlike radiation-based imaging or invasive surgical procedures, ultrasound has no known negative side effects when used properly. At very high levels, the heat caused by ultrasound waves can damage sensitive tissues, but typically use the lowest levels possible. And since modern ultrasound machines can be small and portable, doctors can use them in the field, allowing them to see clearly in medical emergency. Other than that, we have generation of ultrasound waves. What is piezoelectric effect? It is converting electrical energy to mechanical pressure and vice versa. Let's look at quartz, a piezoelectric material made of silicon and oxygen. The oxygens have a slight negative charge and silicons have a slight positive, creating a separation of charge or a dipole along each bond. Normally, these dipoles cancel out each other, so there is no net separation of charge in the unit cell. But if a quartz crystal is squeezed along a certain direction, the atom shifts. Because of the resulting asymmetry in charge distribution, the dipoles are no longer cancel each other out. The stretched cells end up with a net negative charge on one side and net positive on the other. This charge imbalance is repeated all the way through the material, and the opposite charges collect on opposite faces of the crystal. This results in a voltage that can drive electricity through a circuit. Piezoelectric materials can have different structures, but what they all have in common is unit cells which lack in center of symmetry. And the stronger compression on piezoelectric materials, the larger the voltage generated. Stretch the crystals instead, the voltage will switch, making current flow the other way. More materials are piezoelectric that you might think. DNA, bone, and silk. All this has the ability to turn mechanical energy into electrical. Scientists have created a variety of synthetic piezoelectric materials and found application for all of them in everything in medical imaging to inkjet printers. Piezoelectricity is responsible for rhythmic oscillations of the quartz crystal to keep watches running on time and the speaker of musical birthday cards. Apart from that, we have ultrasound scanning modes. We have various of display modes. Ultrasound imaging, different modes are used to examine the different parts of our body. The different types of modes can be controlled by the operator. These are the following modes. First, we have A mode, B mode, M mode, and also lastly, Doppler effects. What is A mode? A mode, which is amplitude modulation, is the display of amplitude spikes of different heights. It represents the time required for the ultrasound beam to strike a tissue interface and return its signal to the transducer. The greater the reflection at the tissue interface, the larger the signal amplitude on the A mode screen. This graph consists of x-axis and y-axis. X represents the depth and Y represents the amplitude. A mode can be used as ophthalmology and echocardiology. It is also used as an adjunct to B mode's displays when accurate depth measurements are required. Furthermore, we have B mode. B mode means brightness mode. It displays of the 2D map of the ultrasound. The display echo signals are electrically converted to intensity modulated dots on the screen. Brightness depends upon the amplitude or intensity of the echo. The emote display is used both in generating emote trace and in grayscale. The advantages of remote is that it has large field of view obtained. And next, I want to talk about emote. Emote is also called as motion mode. It is the display of a one-dimensional image that is used for analyzing moving body parts. Spikes are converted into dots. The single sound beam is transmitted and reflected echoes are displayed as dots. This mode allows trace of motion. It is also varying intensities, thus creating lines across the screen. The advantages of emote is that it is most useful in echocardiography and fetal cardiac imaging. And lastly, we have Doppler mode. It measures the change in frequency of the reflected sound wave due to motion, which is Doppler effect. It is used to assess blood flow and velocity. It includes color Doppler, pulse wave Doppler, and continuous wave Doppler.
Now let's move on to the applications of ultrasound. There are few applications that are obtained from this topic. On the medical diagnostics, ultrasound is used in cardiology and abdominal imaging area. It can evaluate heart function, detecting heart diseases, and assessing blood flow, and also to examine organs like the liver, gallbladder, kidneys, pancreas, and spleen. In the non-medical area, it's used in industrial non-destructive testing to inspecting materials and structures for integrity, and marine navigation and fish finding to use sonar technology to detect objects underwater.
Probe is used as a handheld device that emits and receives ultrasound wave to create image of internal body structure. It contains piezoelectrical crystal that convert electric signal into sound wave and back into electrical signal after reflecting off tissue. It also an instrument used by doctor to physically explore or examine body cavities, tissue, or wounds. Probes come in various types, each designed for specific application across different fields. Here are some of the main types of probes along with the specific function. Straight linear array probe. This probe is designed for superficial imaging. The crystals are aligned in a linear fashion with a flat head and produce sound wave in a straight line. This probe has a higher frequency which provides better resolution and penetration. The image produced is rectangular in shape. This probe is ideal for imaging superficial structures such as vascular, musculoskeletal, skin, and soft tissue. Curvilinear array probe. This probe used for scanning deeper structure. The crystals are aligned along a curved surface and cause a fanning out of beam which results in a field of view that is wider than the probe footprint. These probes have frequency ranging between 1 and 8 MHz which allow for greater penetration but less resolution. The image generated is sector shape. This probe used in procedures such as abdominal, transabdominal, pelvic evaluation, and kidney. Endocavitary probe. The endocavitary probe also has a curved face. This probe has higher frequency than the curvilinear probe. This probe used for transvaginal ultrasound, intraoral evaluation. Lastly, phase array probe. This has a smaller and flatter footprint than the curvilinear one, which allows the user to maneuver more easily between the ribs and small spaces. This probe have frequency between 2 and 8 MHz. This probe usually operate at the higher frequency for viewing the abdomen, pelvis, and for abdominal imaging and imaging between ribs in the flank. To conclude everything, ultrasound technology broad range of application across medical, industrial, research, and veterinary fields underscore its versatility and importance. As future direction in technological advancement in continual improvement in image quality, miniaturization of equipment, and integration with other imaging modalities. Its ability to provide real-time detailed image while being portable and safe make it indispensable in modern medical practice and beyond.